Assalamualaikum and good day everyone. I am Noraifa A Kapampangan, and for today I will be discussing about the post-operative health teaching and instructions for Myringoplasty. So the content of these presentations are the definition of Myringoplasty, post-operative instructions and discharge plan for this procedure, acknowledge the importance of these tips to encourage faster healing, and know the symptoms when to call the doctor. So before anything else, let us first define what is Myringoplasty. So Myringoplasty is a surgery to fix a hole in your eardrum. A graft is used to cover the hole. The graft may be a piece of fascia or hard tissue that covers muscles, skin, fat, or cartilage from another area of your body. The graft may be artificial, from a donor, or from an animal. So Myringoplasty is done to help prevent middle ear infections and improve hearing. So these are the actual photos of the Myringoplasty, or the case of my hypothetical patient having Myringoplasty. So as you can see, the healing process is step by step from pre-operation to post-operative after 3 months. So we have here also the actual photo of the eardrum having a hole and the eardrum after putting a graft on. So let us now proceed to the post-operative instructions and discharge plan for this procedure, Myringoplasty. So the first one is you may change the small band-aid or the graft and cotton whenever necessary. Do not allow the ear to get wet. Do not remove any packing in the ear canal. You may not be able to tell it is there, but if your hearing feels blocked, do not try to clear it. If you have any stitches, keep them clean and dry. You will return to the office about 1 week after surgery to have the stitches removed. Do not allow shampoo, soap, or water in the stitches. Do not lie flat. Use 3 pillows to keep your head up at night. No smoking. Do not consume alcohol while taking pain medication. Do not return to housework, yard work, or your job until your surgeon tells you it is okay. Avoid coughing, sneezing, and blowing your nose. If you must sneeze, keep your mouth wide open. No exercise or gym class for approximately 2 to 3 weeks after surgery. If your work involves heavy lifting or is heavy strenuous, you will need to be out of work for 2 weeks. If you notice any dizziness, bloody drainage, or drainage that looks like a pus, or if you have increasing pain, call the office. And lastly, your first post-operative visit will be about 1 week after the surgery. So these are the general post-operative instructions and discharge plan for this procedure. So let us now move on to the home care and instructions after the procedure. So for the wound care, for 1 to 2 days, there may be a small amount of blood oozing from the incision inside the ear canal or behind the ear. Your doctor will indicate when the head dressing and gauze can be removed. For 1 to 2 days, there may be a small amount of blood oozing from the incision inside the ear canal or behind the ear. Ear packing may fall out, but do not remove it. Apply ear drops directly packing. In 1 week, skin tape covering the incision may be removed if it has not fallen off. Do not remove any stitches as they dissolve on their own. So for the activity restrictions, your doctor will indicate when it's okay to return to work or fly. To decrease chance of bleeding, don't lift more than 20 pounds or strain for 2 weeks. Do not strain on the toilet or blow your nose or sneeze with your mouth open. Take care when driving, walking, and showering, as there may be dizziness or imbalance for days to 2 weeks after surgery. So for the diet of the hypothetical patient, the diet is unrestricted, meaning you have to resume a normal diet as tolerated. Consume healthy food and maintain hydration by drinking plenty of water. Food may be taste different or there may be decreased taste for weeks to months. So for caring of the ear, We have here the eardrops. Your surgeon may give your child a prescription for eardrops post-operative. Please follow the instructions on the prescription if eardrops are needed. We have also here water precautions. It is recommended that the patient keep his or her ear dry for the first 2 weeks after surgery. This includes swimming and showering or bathing. Please use earplugs or a cotton ball dipped in Vaseline. And lastly, encourage your child to avoid nose blowing and to sneeze with his or her mouth open for 5 to 7 days. So for the discharge instructions, we have for the medicines, take your medicine as directed. Contact your healthcare provider if you think your medicine is not helping or if you have side effects. Tell him or her if you are allergic to any medicine. Keep a list of the medicines, vitamins, and herbs that you take. Include the amounts and when and why you take them. Bring the list or the pill bottles to follow-up visits. Carry your medicine list with you in case of an emergency. So we have here also the antibiotics. This fight or prevent an ear infection caused by bacteria. They may be given as pills or ear drops. We have also here the antihistamines. This help prevent symptoms of allergies such as sneezing or itching. And we have also here the steroids, which decrease pain. So, and last, for the pain medication, you may be given a prescription medicine to decrease pain. Do not wait until the pain is severe before you take this medicine. So, when are you going to contact your healthcare provider? So, contact your healthcare provider when you have a fever, you have nausea or vomiting, stitches come apart, your surgery site is swollen, red, or has pus coming from it, and lastly, you have questions or concerns about your condition or care. So, seek care immediately or call 911 if blood soaks through your bandage. If you have a headache that does not go away even after you take pain medicine, you have hearing loss that is worse than before your surgery, or you cannot hear anything, you have pain in your inner ear or behind your ear, and lastly, you have trouble making the muscles in your face move when your face move. So these are the actual photos of the eardrum before and after the procedure. So that would be all. Thank you.